So when the dementia diagnosis is given, this is one of the important areas that we discuss with people, that this is a chronic, progressive, and neuropsychological condition. That means that whatever you're going to do, this condition is going to progress. So there is no cure for the dementia, as with many other conditions. But there are a number of things that can be done to help reduce the progression or the speed with which the dementia is progressing. And especially the medications which are they're licensed for the Alzheimer's dementia and some types of dementia, such as a Parkinson's dementia or Lewy body dementia. But for many other dementia, there is no specific treatment or a cure that is available. Now, the medications that are used for the dementia are things like rivastigmine, galantamine, and donepezil, which are for the mild to moderate Alzheimer's dementia. But then as a condition progresses, there is another medication that can be used called as memantine, which is used for the more severe stages of dementia. Now, when you use this medication, you have to be very careful and then explain to the person, an individual, they must know and they must be aware of some of the side effects this medication will have, and also the expectations from this medication. So these medications will not be curing the Alzheimer's dementia, but they will be helping reduce the speed of progression. So over a period of time, things will go downhill and things will progress, but they will progress a bit slowly compared to if you're not taking the medication, when they will be they'll be progressing a bit fast. So the dementia presents with variety of symptoms. So there might be presentations with a memory, language difficulties, executive tasks, thinking, judgment, decision making, learning new information, and there are a number of language deficits can be there as well. Most of the medications which are used in the Alzheimer's type of dementia, which are donepezil, galantamine, and rivastigmine, will be helpful in enhancing some of the cognitions which are being impacted. But just to be careful, the improvement that you will notice with this medication will be very minimal. But what we say improvement in dementia is the stability. If somebody is maintaining the stability, then the dementia medications are working. Now, there are other non-cognitive symptoms of dementia which can be present. So we describe them as behavioral and psychological symptoms of dementia. They are very common symptoms which can be present in more moderate to severe and late stages of dementia. That includes the behavioral component, that is like agitation, aggression, wandering, hitting, pushing, grabbing, punching. All sorts of behavior you can think of can be present as a behavioral component of dementia. But also there can be some of the psychological components, for example, depression, apathy, anxiety, hallucinations, delusional beliefs, psychotic phenomena. So they can be behavioral components of these symptoms, but there can also be psychological components of the symptoms. And the medications which are used for this they have to be used cautiously. NICE guidelines always says that you try the non-pharmacological methods of management for the behavioral and psychological symptoms of dementia, rather than resorting on the medication in the first instance. If the non-pharmacological methods of management are not working well, then we can think about using the medication. And there are a variety of medication depending on the target of the symptoms. So for example, there is agitation or aggression. There might be a low dose of lorazepam or benzodiazepines. Diazepam can be used. But in some cases, when there is a psychotic symptoms present, then the NICE guidelines recommend to use some molecules such as risperidone, which can be used, but that has to be monitored on a regular basis so that the side effects do not occur. So we have talked about there is a lot of research done about the fish liver oil, cod liver oil, but they've been inconclusive to see whether those treatments are helpful in countering the dementia process. But there are many other things the patient with dementia or the family members can do to help improve the presentation. And there are things like cognitive stimulation. So something which stimulates your brain. So a lot of people are interested in doing Sudoku, crosswords, puzzles, and quiz programs, and reading. So basic things like gardening and these type of activities that can stimulate your brain, that can cause the person to think more or to concentrate and focus on some task. It is very important to do that. Some people are interested in reading. They might not follow the whole train of thought, but still reading stimulates someone to think about something, what has happened in the last paragraph or what happened in the last chapter, and that stimulates the brain as well. Talking about the current events, what is happening around, also something that stimulates people's brain, and that is something which is helpful to do. Apart from that, the lifestyle modifications that we talked about earlier on, having a healthy diet, having the food which is not very cholesterol rich, and that is something which is not significantly carbohydrate rich, things which are to do with the leafy vegetables or the fruits and the proteins will be something to concentrate on. So I think these are the more of the natural remedies that can be helpful in slowing down the progression of the condition. If you're living with somebody who is suffering from dementia at home, you can be a spouse or a family member, such as a son or a daughter, then your main role will be a supportive role. So many of the times, dementia patients can be forgetting things or they become repetitive. So they'll be asking some questions many, many times. And at times, the people who are living with the dementia patients can get frustrated and try to respond in a similar way, which can increase the agitation and anxiety of the individual. So one of the best methods to do is to distract people from dementia who are asking repetitive questions. For example, if somebody is saying, what is the time? And you say it's 10 past 10. And they ask again, what's the time? You say 10 past 10. And the third time and the fourth time. And then what you can do is, instead of getting quite agitated about it, you can distract and change the subject to talk about something else. So talk about, what is the weather like? Do you want a cup of tea? Do you want coffee? Do you want to go out? So these are the things which are distraction methods that can be used to take away the person from the topic what they're talking about, so that they're not getting quite wound about it. There are also the other things that can be done. So when the diagnosis of dementia is given to the people, this is a one-way diagnosis. So what I mean by that is the improvement in dementia is minimal, but the stability is very important thing that can happen with the help of medication and the support. But the slowness of the speed can be slowed down with the medication. And during that time, it is good to look at the lasting power of attorney. Look at the driving. If somebody is driving, whether they need to drive, there is an important implication of dementia diagnosis that the DVLA and the authorities have to be informed. So the family members can help and support, inform the authorities that dementia diagnosis have been given, and the advice would be better that the patient doesn't drive. But obviously, the information to the DVLA is pivotal to be given by the family members, and you can support the individuals with dementia in that manner. But also giving them independence. So not making them completely dependent on yourself. So for example, if they are able to make tea and coffee, do small household chores like washing and changing and cleaning, and also doing the washing line, for example, you can provide that environment, the help and support for those individuals to continue to be independent. Because if they don't use these skills over a period of time, there is a risk that they might lose those skills, and the dementia might progress further. So the medications which are used for the management of Alzheimer's dementia are the donepezil, galantamine, and rivastigmine. These medications obviously are well tolerated by dementia patients, but there are some common side effects that can be there. So patients can present with dizziness, sometimes giddiness can be there, lightheadedness, headaches, gastric upset, or nausea will be there. These side effects generally pass away within 3 to 4 weeks' time. So the patients need to persevere these medications before making a decision to stop them. And there are some significant side effects with these medications as well, but thankfully they're not very common. So people who start this medication in the first few doses can experience diarrhea. So that has to be looked out and watched for. And if that happens, then immediately the concerned clinicians should be informed about that. And also there is another side effects which is quite important, is the bradycardia, or the slowing of the heart rate. So when you start the medication, first of all, we would check the pulse rate, the heart rate, the blood pressure of the individual to see whether it is within the normal range. And if it is not, and if it is dropping, once the medication has been started, the authorities or the clinicians have to be informed to make a decision whether these medications are suitable and should be continued. But these are thankfully not very common side effects of the medication. The other medication which is used for the more moderate to severe stages of dementia is the memantine. So memantine is well tolerated again, but again, as with other medications, some side effects will be there. The things like constipation can be there, agitation can be there in some individuals, and nausea and gastric upset can be present. Lightheadedness and headaches can also be present. But in some people, there might be rare side effects such as hallucinations, and getting significantly agitated is a problem. But again, this is a rare side effect of the medication, and these medications are generally well tolerated. So the most of the recent breakthroughs have been in the field of the Alzheimer's disease. And there are advancements that are happening. As we understand, the Alzheimer's pathology has been studied fully and significantly compared to all other forms of dementia. And what we know up until now is the deposition of the amyloid protein in the brain in the form of amyloid plaques, and the deposition of the tau proteins in the form of neuritic plaques in neurofibrillary tangles are the two main pathologies of the Alzheimer's disease. There is also other mechanism in which the pathology is known to be causing Alzheimer's disease, and that includes the inflammation, the problems with the synaptic plasticity, and many molecules have been researched in the last 20 years or more. But after the advent of memantine, there was no other medication that was licensed after that. But is more recently there are different approaches that have been researched, and in the last few years there are a few molecules which have come to the focus after the completion of the research. One of the molecules is the lecanemab, and the other one is donanemab, and these are the monoclonal antibodies. So these antibodies do target the amyloid plaques in the brain and cause removal of them, or they'll take away these plaques from the brain, so that the healthy brain can continue its function normally. These molecules will focus only on the amyloid pathology, and they will not be looking or focusing into other areas. The other molecules which are being researched are focusing on the tau pathology. So the neurofibrillary tangles, which are made of the tau protein, those molecules will target this tau pathology and remove that from the brain, and that is another mechanism through which the dementia treatment will be progressing in the future. There are other molecules which are also improving the inflammation, and the problems with the issues with the synaptic plasticity are being researched as well. And there is also multi-target approach molecules which are focusing on different other pathologies of the brain as well, which are impacted in the Alzheimer's disease, are being researched. In the future, there will be many more molecules. By 2030, it is estimated that many molecules will come around in the field of Alzheimer's disease, and to just watch out the space that there'll be more molecules which might be available. Currently in the UK, these molecules are not licensed. They are being reviewed by the NICE and the MHRA at this point in time, and I will have to wait and see what happens with these molecules. These two molecules which I mentioned have been considered with the FDA in the US, but we'll have to wait for the approvals within the UK.